Hi friends, I have the honor of having with me Dr. Aditi Das. She has just passed her MCA screening. The result was declared yesterday, and she's passed MCA screening with 161 marks. And she with the DAMS MCA screening initiative, where we have today classes in Delhi, and we even have classes in various universities in China, in Bishkek. We are now offering classes for MCA screening. I'm very proud of her achievement, and I wanted to know talk to her today so that we can take out from her some guidance for the future aspirants as well. So Aditi, how are you feeling today?
First of all, thank you so much, sir. Without your guidance, all of you, like all the faculties in DAMS, they're the best. If I I have been to many other institutes as well. My experience were not so smooth, but with DAMS, I can say confidently, yes. Today, at least I know something, if not everything. Everything is a myth in medicine, of course, but still, I know something.
So kind of you. So finally feeling relieved?
Yes,
Relieved. Well, the first feeling
yes.
is of joy or relief?
It's of joy, of
Joy.
course,
Yes.
because I would like to thank my parents because
Yes.
they are so happy that they cried yesterday,
Yeah.
actually.
So where did you graduate from?
I graduated from Nepal,
Okay.
Chitwan.
Okay.
It's like College of Medical Sciences in Chitwan.
And did you experience that there is a gap between the graduate education that you did and the kind of question they are asking in MCA screening?
In MBBS graduation, we study the whole book.
Hmm.
We are not aware of the most important point or most common questions that they ask. Maybe the most common carcinoma in lungs. We might not be aware. We might be aware of all the carcinomas that occur in lungs. That is a problem that we face. And what is the most common? They all generally ask the most common terms, and we are not acquainted with all those things. So it is a problem, yes. And when we go to the guidebooks, different guidebooks give different answers, and that
Plus,
is a
there's
problem.
so many guidebooks
Yes,
available. It's
yes,
so confusing there.
yes.
So how did you manage? When you came to dams after your initial bad experience that you had with some other guidance and all. When you came to us, how did you manage your classes? Like how did you make it a point that in the class I will listen carefully, write, or maybe were you using highlighting? Or what was your strategy? You were telling me before that
First
how
of all,
did you use the classes?
I first I made this point that I should attend all the classes.
Yes, that's very
Whether I
important.
understand, whether I don't understand, I should be sitting there. I should jot down the notes. And I don't believe personally in changing pens and making it decorative. I
Yeah.
believe in copying down and knowing all the, I mean, jotting down all the facts that the faculty is trying so hard to provide to us, to deliver to us. We should have the list of the points, whatever they want us to know, because they are the best people who know that the right path through which we should go to reach the destination. So I jotted it down, and then I went home, and then I first though I just read it for 2 times. I read it. I didn't understand. On the third time, yes, I started to understand what is there. Of course, the class, when I was in the class, lectures helped, but still, self study is more important. Everything cannot be spoon fed in the class.
So what I feel is that the way you worked this time around was that you after the classes you made it a point to do it again
Yes.
and again, again and again till the
and
time it
and
becomes clearly
yes, sir.
embedded in your mind.
Yes, sir.
Yeah,
and
that has probably made all the difference this time
and
also.
I believe it should be it everybody should make it a point that they should study the notes the same day.
Yes.
They can retain more. If
Yeah.
I mean, if they don't understand also, it is okay. Just
But I
give
think
it a read.
repeated reading helps to
Yes,
understand also.
yes,
Like sometimes what happens is that when you are exposed to a concept for the first time, especially in shorter subjects like my subject, so probably you might be going into that kind of detail for the first time. But when you read it again,
yes, sir.
again, then gradually you that reading becomes understanding, and that is when the marks improve also.
And in dams, it is all conceptual and it is integrated. So it's not anatomy or radiology separate. When we read radiology, anatomy is included in that. If we don't know anatomy, we can't study radiology. I
Yes.
believe that.
Yes. So did you enjoy your experience with dams?
Absolutely, sir.
Yes. And
I
would
have no
you
words to thanks dams.
do you want to mention some teachers that or some subjects that particularly influenced you, or in the exam you found them particularly useful?
with dams is not always study, it's fun, more of fun. We enjoy it in the class.
Yeah.
Faculties make it a point that we don't only understand, we retain it in an enjoyable manner. Uh, so, like the Obscany sir, he was.
Dr. Anil, I think. Yeah?
Yes.
He is a rock star actually.
Yes, he is.
Yeah.
We never used to think that we are actually in the class.
Yeah.
We can still like imagine the whole drama that was going on in the class.
Yes, but at the end, everything is covered.
Yes,
everything is covered,
yes.
and the questions are there in the exam also.
In 3 days, he did everything, and we were like, okay, this was that. I mean, it is done.
Yes. And plus, you in the exam when you are appearing for the exam, you're surprised that everything is
Yes,
taken
yes.
care of.
And
That is the
there.
magic of actually art
Yes,
of teaching
sir.
actually.
Yes, sir.
It is,
And we remember, it's like because of his whatever he does, the drama and whatever he does in the class, that is why we remember, we retain it.
Yes, he's doing all that to make sure that it is
Yes.
embedded. And I would also like to point out the importance of PSM in the
PSM,
emergency screening
many
exam.
patients came from the notes directly, and sir provided us with PDF also and many important notes also, and that was really very helpful.
And I think Dr. Siddharth also worked with your entire class all the time, and
He
trying to.
integrated the like MCQs, and then he made it a point to conduct CBTs and all, and like visuals also, we were allowed to go to the visuals, and
Yes.
to our relief there was no extra charge.
And did this time what we have done is we have done a separate CBT for MCA screening also. And this time I'm going to do it all over India, like different cities also, where people can go to a computer center and give the mock exam before the real exam, so that they don't get nervous in the real exam.
Yes.
Because sometimes what happens is, even if when you are preparing good, some people at 149, 148, just out of nervousness make 2-3 mistakes, and that costs them 6 months of their.
Yes, sir.
So that is why I want to remove this element of nervousness. I want to give them ample practice in computer centers. So this time we are going to organize it even in Mumbai, Pune, and we are also looking to do in Kerala and multiple cities where we want to be able to give that quality to all graduates. And in future, even the government of India is looking to make a single licensate exam in India to called as exit exam. Although this is still in the the bill is with the parliamentary committee, but once the exit exam comes, everybody would have to give the exit exam. Even foreign graduates would have to give the exit exam. Then they have to prepare at a more conceptual level, because it will be same paper for everybody. And do you want to say something motivating, or out of your own experience that has happened, that when you come from abroad back to India, that initially you face some negativity, and then you gradually work out, you worked hard to be at this position. So do you want to say something to people people would be in different stages. Some of the people may not have done well in this exam also. So do you want to say something to them that should motivate them, that you kept on going.
Yes.
So do you want to say something to them?
Consistency is a must for this exam, and concept building is a must. So I believe never give up. You can do it, and you are no less than any other medical graduate in the world. Not only Indian graduate, everybody has the same syllabus. Medicine doesn't change and the human body doesn't change. So it is all the same. You know everything, you just have to remember it and produce it in the exam, and for that you need multiple revisions, I believe that.
Yes.
That's it.
And
It is easy.
if somebody is not done this time well,
No.
do you think you should dishearten, or you should
No,
start
no,
again
no.
next time he can do it?
No, we can do it. It's like I told already that consistency is a must. The first failure or the second failure, or maybe the n number of failure is not the end. Life goes on, and
Take it
we
in the right
will,
spirit.
yes.
Take it in the right spirit. What happens is, sometimes I've seen it happen to many graduates appearing for MCA screening. Sometimes they give the exam, and because when they first come to India and they start preparing, there are people around who would say, okay, 3-day capsule course, 4-day capsule course, and they will say something will happen, but the magic doesn't happen. And then when the result is very bad, sometimes they go into a cycle of, I cannot study, and then they waste 3-4 months again, and the next exam also doesn't happen, because every 6 months the cycle is there. So my suggestion and my advice to people is that suppose you have not done well this time, Now it is time to first, you initially you have to get acceptance that okay, this has happened. Then you need to chart out a path for the next 4 5 months, and you have to consistently work to build concepts and pass the exam. But if you keep doing the self pity for too long, what happens is the time goes off. You have to kind of face what has happened and then start working again, is the message that she wants to give you from her own experience and how she went about it.
And after exam, it takes almost 1 month to come the result.
Yes.
Do not waste the 1 month. You
Did-
study, you self-study. If you don't join anywhere, you study.
Did you continue studying?
Yes.
So
This
that is
time I gave the exam and I didn't go back home.
Yes.
I am sitting here.
And do you now intend to join us back for PG entrance as well?
Yes, I
Yes.
do.
Yes.
I
So-
think without dams, I don't think I can do it. And with dams, I do have hope I can do it.
Yes, I'm sure you will be able to do this with the positivity that now you have in you, and the kind of positive energy that you are giving to people listening to you today. I'm sure you will be able to do it. Would you recommend dams to foreign graduates who are appearing for MCA screening exams?
It is better to join, and I mean, I am not promoting, but from my personal experience, I'll say it is better to join than to beat about in the bush. I believe this was the best thing, dams, that happened to me. They taught me a lot, and I think I know something now.
We congratulate you again, and
Thank
we
you,
would
sir.
like to convey our regards to your family as well. I think
Thank
it's
you,
a
sir.
big moment for them, and probably one chapter in life has now come to
Yes,
a
sir.
beautiful ending, and now you can think of another chapter in life. And now she's already thinking of PG entrance now, and I would like to use this opportunity to convey this to people as well, that okay, look at MCA screening as a step. Don't look at it as the destination. She just passed it, and immediately she's thinking of the next step. That is the thing that I want to introduce to everybody here, that think about the next step as well at this time only. I will again congratulate her, and we
Thank
wish
you,
her
sir.
all the best for her future. God bless you.
Thank you.